I am Onicka Jones, and this is Access Health GY. Maternal health refers to the health of women during pregnancy, childbirth, and the postpartum period. While motherhood is often a positive and fulfilling experience, for too many women, it is associated with suffering, ill health, and even death. The major causes of maternal health include hemorrhage, infection, high blood pressure, and unsafe abortion. Joining me today to discuss this sensitive matter is Dr. Marvin Wilson. What is the most important things or measures that women should take when attempting to become pregnant?
Well, the first thing that they need to take in hand is whatever illness they already have diagnosed, they need to make sure that it's controlled. So if you're a sickler, ensure that your blood count is up. You need to ensure that whatever issues you may be having are as under control as they can possibly be. If you do not have any illnesses, then generally once you have confirmed that you are of good health, then you can go ahead and do what you have to do to start to get pregnant.
But taking it back to before you confirm you're pregnant and you're planning to get pregnant, are there specific steps that you should take as it relates to ensuring that your body is healthy?
Well, for females, generally, you need to ensure that your nutrition is up, so that your blood count could be good. So your blood count is very important. It's not necessarily something that you need to check. However, if you're having strange symptoms, then they may need looking into, even though they may be something that is not that bothersome. Outside of that, your hydration is very important. Getting into the habit of eating healthy before you're pregnant is very important, because if you have bad eating habits before you're pregnant, when you get pregnant, then that can lead to issues for you as well as your unborn child. Outside of that, any other general family illnesses that you may know of, it may be worthwhile just to do a check to see if you have come down with any of these ailments. In a lot of cases, it may be very early. However, if you are on treatment and you wish to become pregnant, some ailments, the treatments do not interfere with your ability to get pregnant. Some do. So that is something you would need to follow up with whichever physician is your care physician for your ailment. In the event that you discover that you do have something that it's off, let it be low blood count, let it be that you find that you're having some pressure issues or your cholesterol is high, it would be advised that you bring these newly found conditions to a state where they're controlled before you begin to attempt to get pregnant, even though you may not be having symptoms.
Okay. I've heard the talk about using folic acid prior to becoming pregnant. How important is that?
Folic acid is one of the vitamin Bs. It is very, very, very important for your general nourishment, for your blood count, your ability to fight off and recover from infections and ailments. It's also very, very, very important for the entire aspect of development of the child, but more so in the first 3 months, which is usually, especially in the case if you're not, actively, consciously trying to get pregnant, usually in the first 3 months of pregnancy, that is when females would find out that they are pregnant, usually to the later part.
But there's no harm in using it prior.
Folic acid, using it as a supplement before you're getting pregnant or while you're getting pregnant or attempting to get pregnant is actually a recommended something for you to do. It's not something that your body would take too much of. So the case of you using it and you not needing it and then having a adverse reaction or something of this sort, is the chances of that are almost nil.
Okay, so now that you've talked about preparations, what are some of the possible complications women experience in early pregnancies, and how can they look out for these?
The most common issue in early pregnancy is anemia or low blood count. In a lot of cases, women start the pregnancy with a relatively low, it might be normal, but to the lower part of the normal range, and they continue with their diet that is relatively not too healthy, not a lot of green and leafy vegetables, not too much of vitamins, so not too much of fruits inside the diet and so on. And they continue that in the early part of their pregnancy, but now they have this growing child or this growing embryo inside of them. And in order for this fetus or this embryo to develop, it needs these nutrients. So once they are available in the system, what happens is selectively it goes to the developing fetus and less of it goes to the upkeep of the mother. And that is how you tend to have these issues like your blood count going low, because a lot of the building blocks for your blood count is utilized by the growing fetus. So the mainstay of you getting them would be in your diet. So if your diet is bad, usually you can come down with issues like anemia. Another very common issue that women would come down with is gastritis or dyspepsia in early pregnancy. Everybody knows about the morning sickness and so on,
Yes.
Which is caused from the increase in the pregnancy hormone, your gonadotropin. However, in a lot of cases, if your diet is appropriate and your lifestyle is appropriate, you're not in the habit of skipping meals, you don't use a lot of excessively hot, excessively cold, you don't eat too late, you will take time before you lie down to sleep, after you eat. If that is your lifestyle, it decreases the chances of you having the morning sickness, and if you do have it, it decreases the length and the severity of it, how bad it would be. But again, that is not the common practice. So very, very commonly you have women with very, very exaggerated morning sicknesses.
Okay, well, I personally didn't know that it had an impact based on your eating habits and all of that.
Yeah.
I thought it's something that, you just have to deal with when you're pregnant.
It doesn't happen with all women. It's very common to happen, but it doesn't happen with all women. And if you are predisposed to it because you have a pre-existing condition like gastritis, which is a swelling of the lining of the stomach, then more than likely you're going to come down with it. Okay. However, early stage of gastritis, most persons don't have much symptoms.
After this break, the discussion continues on risk factors, signs of a miscarriage, and more. This is Access Health GY.